Hello, this is Bobby,
I'm Julia.
and we're here today to talk about yeast candida. So, it's not a very well-known disease, but it's extremely prevalent.
I'd probably say like 1 out of every 4 customers that come in the store, their pets have yeast candida and they just don't know it, or it's been misdiagnosed or something like that.
Yeah. So, the telltale signs of a yeast infection is black, moldy smelling discharge. A lot of the time it'll be on the ears. Sometimes you'll find it in the skin. Sometimes you'll even get thrush in the tongue, so it'll be kind of like pasty and gross.
It's also like associated with like the Frito smell between the toes.
Yeah, I hear that a lot, Fritos, which is kind of disturbing for Fritos.
Yeah.
So I'm going to give you a couple of examples here of some severe cases, but you see what they call elephant skin, that's very like dry, very dark, and that I guarantee you smells like Fritos.
They just lose their hair like that too.
But more often what you'll see is kind of just like a graying, and just look kind of off in color. But the big one is right here, the ears. There'd be tons and tons of people come in and they say, my dog has these black moldy ears, and that's a telltale sign. So, yeast candida is when something causes the bacteria in your stomach that's beneficial to die. That causes the yeast, as well as other things, to kind of just build up in their stomach and their digestive tract and just
start over the whole body.
Yeah. So when you see the mold, the smell, that's actually the yeast coming out their pores, out their ears. It's very commonly misdiagnosed as an allergy. For some reason at veterinary school, it's often taught that any signs of yeast are a side effect of an allergy.
Which can be true, but it's usually not the case.
Yeah. In reality, it's vets prescribe antibiotics a lot. Most of you will be able to kind of relate to that you go to the vet and they give you antibiotics and steroids. Well, that's what kills the good bacteria. Some cases in like Europe, they'll actually prescribe you a probiotic as well. That's great because the probiotic rebuilds that natural bacteria. So basically what causes a yeast infection, and you'll notice we're using a lot of human stuff because it's not really dealt with in pets that much.
It's not very well known in pets.
So a lot of the time we'll rely on human research because it does tend to be a little bit better, a little less influenced by money, things like that.
Also, most people can relate to having a yeast infection.
Yeah. So, as you can see, people taking antibiotics and people with immune-compromised bodies, such as diabetes, are more prone because the immune system's down. It's not fighting off the yeast like it normally would. Because in a healthy body, the yeast comes in, you deal with it, it's out. You don't even know it was there.
Yeah, bacteria would kind of keep it in balance.
So, what do you do for yeast infections? Basically, there's 3 stages. You have to kill the yeast, rebuild the intestinal flora, and don't feed the yeast. So a lot of the time I'll see people do one of the 3, and it will have some results.
It could help, but it's probably not going to solve the problem.
Yeah.
Especially not in a decent amount of time.
So as far as antifungals, what we typically recommend would either be olive leaf, coconut oil, or oregano. Those are 3 natural, very safe ingredients that have strong antifungal properties.
We obviously lean more towards the olive leaf because that's one of our products.
Yeah, shameless self-promotion of the day. Probiotics are pretty standard. There's a few different strands and things like that. By all means, you can give them a human probiotic. You can give them probiotic yogurt. The only, I wouldn't call it downside, but more just waste, is in humans we use a lot of lactose-based probiotics to help our body digest lactose. Not super relevant for pets, so if you find a pet probiotic, most of the time they'll just skip those because it's not relevant, it's just a waste. Not that it's harmful to be there, it's just not necessary. And then there's don't feed it. So first I'm going to give you an example of a high carb food. So yeasts are fed by starches and sugars. So we'll get it out of the way first. Raw food, yes, great for yeast candida. There is no carbs most of the time. Has no carbs, so that's a good option. But for those of you that want to do kibble, practicality, or whatever, then here's some of your options. So you'll notice that Hills has a gastrointestinal biome food. It's sold through the vets. You would assume by the name that would be perfect. But when you go down here to the proteins, fats, carbs, it's 52% carbs on a dry matter basis. So I'll account for that when I'm doing the comparison. But as you can see, really high in carbs. And the reason for that is the veterinary foods are all high carb. Barley, rice, corn, well, corn gluten, that wouldn't have starch, but whole grain corn would. Mm-hmm. Whole grain oats, pecan shells, powdered cellulose, which if you don't know, that's basically just wood pulp. Yeah. Beet pulp. So, yeah, there's a lot of starches in there. Some of those carbs are going to be fibers, and that's fine. There's nothing bad about fiber, really.
They would basically just pass through get undigested, but
yeah,
also a lot of undigestible things in that food.
Yeah, when there's 52% carbs, it's not all going to be fiber, especially when we look here and the crude fiber is 7%. So it's high in fiber, but not high enough to offset the 52%. So I'm going to be comparing that to Origin, and they don't list their carbs, but looking at the ingredients, you can see very meat heavy. Mm-hmm. So I did the math for you. If you're ever looking to find out carbs, because they're typically not listed, you just take the protein, fat, carbs, moisture, ash, and it all adds up to 100. Sometimes they're not going to give you the ash either. You have to kind of ballpark it. It's not going to be super accurate, but I usually just use 10%. So in Hills, like I said, I have to account for the fact that they're using dry matter and Origin's 12% moisture. So what you do there is you just multiply it by 0.88, and that'll give you a 12% moisture. So it goes down to 46%. Origin, we do the math, we get rid of the protein, fat, moisture, ash, and we're left with 23% across the carbs. So, like I said with the other food, you have to account for fiber, but because in pet food they only list one of the fibers, you can't really know the exact number.
Yeah, it's not super accurate.
So I'm just going to go with carbs as a whole here. So the other thing that we have to take into account here is not only is it twice as high in carbs from a percentage basis, but
you also feed twice as much per day.
Yeah, Hills you have to feed 4 cups. Origin you have to feed 2 cups, and that's actually to a slightly heavier dog, but it's not enough to bother doing math. So in the end, you're actually looking at 181.7 grams per day of carbs on the gastrointestinal biome food, as opposed to 55.2 grams of carbs on the Origin. So that's less than 1/3 the amount of carbs. So that's going to end up feeding that yeast like crazy. So a lot of people ask me, is this something I'm going to have to deal with for the rest of their lives? And the answer is not really. It can be cured.
Yeah, as long as you take the right steps.
Yeah, the big flaw a lot of people will do is they'll stop once they see it gone. But in reality, it's in the stomach, so it doesn't really show as well. So you want to continue treating it for a month or two at least afterwards, just to be safe. Try and make sure you get the whole thing. So we've got an example here of a dog that has a pretty bad case on his back of Yeast Candida, and over the course of 35 days, he looks a lot better. And I've absolutely seen this. They can turn around and just be completely better if you catch it on time, if you're able to do the right things. One of the things we didn't really mention earlier is obviously you have to stop giving antibiotics whenever possible, because that's just going to keep killing the good bacteria.
If you keep killing the bacteria, it's really hard for it to build back up to a decent amount.
And antibiotics aren't the only thing. A lot of drugs, including vaccines, are very hard on the system. So I always recommend giving probiotics whenever you have to medicate or vaccinate. Just, it's one of those things where it's never a bad thing to give, and it can save you so much heartache and pain by just taking that precautionary measure. Alright, so I hope that helps everybody, and that a few of you will be able to use that information to help your pets. Thanks for watching.